Hello everyone, welcome to the workshop. My name is Faisal Jahangiri. I am Vice President of Clinical Affairs at Access Neuromonitoring. Today we are going to do a workshop on train of 4. The train of 4 setup is very important and should be done for all the cases when we are doing EMG monitoring and motor evoked potential monitoring. The train of 4 should be done from the most distal part of the body because the muscle relaxant wear off from the face first, then the upper extremity, and at the end from the lower extremity. So if you're monitoring any type of recording from lower extremity, your train of 4 setup should be in the lower extremity and should be on the foot. So let's talk about how to do the setup. So the best way is to place your electrode on the left and right medial malleolus for posterior tibial nerve stimulation. So we put that cathode distal and anode proximal. If you are doing the same setup for sensory evoked potential recording, in programming we just have to invert the stimulation. Instead of normal, we do invert. So the distal becomes cathode instead of the anode, and we stimulate from that. For recording, you have to place the subdermal needle on the foot and have to be placed on the bilaterally. So if there's a problem with one side, we can switch to the other side and record from both left and right foot. We place the subdermal electrode in abductor hallucis muscle and extensor hallucis longus muscle in the foot. If the patient has edema or a cast or swelling on the foot, you can use subdermal 13 millimeter needles for stimulation. But in normal patient with no edema and no swelling, it's always recommended to use a sticky electrode for stimulation. The setup is very important, so because if you're comparing the train of 4 to the international references, it has to be set up in the same way as other people do that. So we always have a pulse rate set to 200 microsecond. The rep rate is 2 Hz for 2 seconds, and the sweep should be 20 millisecond per division if you're doing all 4 recording at the same time. And the current you can stimulate from 0 to 100 milliampere, but all of them will have a different meaning. The normal threshold of the nerve is about 2 to 3 milliampere, and if you are doing an intraoperative and the patient have no muscle relaxant, it should be around 20 or 15 to 20 milliampere. Don't have to go higher. If you go higher than that, that means there's a problem or the patient has some kind of muscle relaxant in that area. So if you have 4 out of 4 twitches, that means patient has 0 to 5% paralysis because some anesthetic agents have some minimum paralytic effect. If you lose 1 twitch, that means you have 3 out of 4 twitches. That means you have 65 to 75% muscles are paralyzed. If you have 2 out of 4 twitches, that means 85% muscles are paralyzed, and 1 out of 4 twitch means you have 95% muscle paralyzed. And if you have 0 twitch, that means that you have 0% paralysis. So in order to do the best recording and optimal recording, it's always recommended to have 4 out of 4 twitches, because losing a 1 twitch and having 3 by 4 twitch means you have about 70-75% muscles are paralyzed. So always try to make sure you are doing your own train of 4 and it's documented and should be done very frequently, and it's one of the most important part doing for the EMG recording and for the motor evoked potential. So if you're getting train of 4 out of all 4 twitches, that means patient has no paralysis or 0 to 5% paralysis. If you lose 1 twitch, that means if you have 3 out of 4 twitches, that means that you have 65 to 75% muscles are paralyzed. If you have 2 twitches remaining, that means 85% muscle are paralyzed. If you have only 1 twitch, it refers to 95% muscles are paralyzed, and 0 twitches mean 100% muscles are paralyzed. So in order to do the best recording for EMG and motor evoked potential, you need to have 4 out of 4 twitches, because losing a 1 twitch means you have 75% muscle paralyzed. And when you are measuring the height of the twitch, you have to make sure you don't have more than 30% fade. The best one is to have only 10% fade on the 4th twitch, but you can go up to 30% fade, but not more than 30% fade. Having a more than 30% fade means that twitch is absent.